Listen-only mode.
Hello, my name is Jan O'Neill, and I'm a community coach with the County Health Rankings and Roadmaps program. And I'm joined here today by my colleague, Sarah Ansell, our Action Center Assistant Director.
Hi, I'll be helping to answer your questions and sending out some chat links in the chat box throughout the webinar.
And we are very excited to have Wade Norwood and Dina Faticone from the Finger Lakes Health Systems Agency with us here today to talk about how they are using the power of story in their work in Rochester, New York. The FLHSA is a not-for-profit community health planning agency that promotes public health in the Finger Lakes region through research, advocacy, and community engagement. So hello, Wade and Dina.
Hello.
Hi, Jan. Nice to be here.
Great, good to hear your voices. And I know you both are on a speakerphone, so if we hear from our participants that they're having a little hard time hearing you, what we might do is ask you to speak up a little bit. But I know that we'll be able to hear you just fine. So thank you.
You're
And
very welcome, Jan.
yeah, great. Thanks for being with us. And we are going to do a little experiment today. When we wrap up this webinar at the top of the hour, we'd like to invite you, participants, to join us for a 10 to 15-minute chat after the webinar with our guest presenters, Wade and Dina, so you can have a chance to have a little bit of direct dialogue with them and with each other. When we do this, we'll unmute all the lines, so if you have time for a little after-class chat with us, please feel free to join us in this experiment. So I'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And we want to take a moment just to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window where you will see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. So please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. And Sarah will be monitoring that. So here's a look at what we're going to talk about today. We'll start with a brief overview of the County Health Rankings and Roadmaps program and a couple of selected tools to help set the stage for our topic today. We'll then talk with Wade and Dina about their work in Rochester, and we'll be asking them some of the questions that we collected from the registrations for this webinar. We'll also be sure to leave some Q&A time for questions you send to us during this webinar. Then we'll wrap up with ways to stay up to date with the County Health Rankings and Roadmaps developments. And again, once the webinar is officially done, we'll keep it open and unmute lines for those of you who would like to stay on for a few minutes of after-webinar chat with Wade and Dina. This question guides our webinar today. How can we use our stories and lessons learned to build a movement for a culture of health in our community? And we'd love to hear your examples. So right now, if you could use the chat box where Sarah is actually going to chat out this question. What communication or storytelling methods are working well in your community? If you could send your answers back to us in the question box and tell us what's worked well in your community. Be sure to include the name of your community so that we can share this with others on the webinar. So we'll just take a minute or two here, pause, and let's hear from all of you about what communication and storytelling methods are working well in your community. So it looks like we have some great contributions here. I see that there's in Escambia County, hello Elisa, for Live Well Northwest Florida. They're using a monthly newsletter and they've seen some great results. And they have a new format there, which that sounds interesting. Let's see. Violetta, I'm not sure where you are, but you're disseminating information through media and social networks and conducting regional needs assessments to show a specific region. We've got Marie doing a roadshow. Please let us know where you folks are so we can connect you to each other. You're doing a roadshow to share findings with your community health needs assessment and associated stories. So that's great. Yeah, we've heard a lot about roadshows. I know we did a webinar with Cattaraugus County in New York, and they do that as an ongoing kind of way of getting the word out and involving and engaging important stakeholders throughout their county. Some folks are using awards and recognition events, such an important thing to do. We've got digital storytelling. Oh, that's wonderful. We actually have a tool on our website for digital storytelling, and I know that that's a question many of you had about what is the way to really construct a story, and our digital storytelling tool gives some good templates for that. That's up in Alaska using qualitative data on alcohol use and abuse. Oh, Violetta, thank you. You're in Region 11 of South Texas, and Marie is in Vermont. Thank you so much. Unfortunately, we can't help you all see each other's answers, and so that's why we want to do this experiment toward the end of the webinar, after the webinar, so that we can have a little more direct dialogue with each other. We're working within the confines of this particular technology. So thank you all. That's awesome. So moving along here, as we move into the content, we'd like to ask you to consider these questions. Who else do you need to share this information with? And what's one idea for action that you're taking from this webinar? And what else do you need to know to take action and use this information? We'll start with a brief program overview to ground our discussion in county health rankings and roadmaps. And if you're newer to us, this is going to give you a high-level overview of our program. And to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars, which Sarah is going to be chatting out a link to our most recent recording. This image shows the relationship between policy, health factors, and health outcomes, and it's the basis for the rankings report, which we issue each year in the spring. It illustrates why it's important for communities to take a broad definition of health and commit to sustainable, long-term, policy-oriented solutions. Many factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, access to healthy foods, community safety, and our social connectedness. Those are all examples of things that impact our health outcomes. So for each county, you will find two rankings. Those are in the one is in the green for health outcomes and one ranking in the blue for health factors. Health outcomes show how healthy each county is, and we look at the length of life and quality of life of residents in a county. Health factors are those things that influence health outcomes, and specifically, we look at health behaviors, clinical care, social and economic factors, and the physical environment. And we know that effective local, state, and federal policies and programs can improve these variety of factors that in turn shape the health of communities. So I want to just pause here for a moment and ask Wade to give us a quick preview of what we'll be hearing from him and Dana later in the webinar. Wade, where is your work focused, just using this image as a visual?
I would see our work having activity in the areas of tobacco use, diet and exercise. We have about a dozen staff, including clinicians, who work with regard to care access and quality of care. We do a great deal of work with regard to education. Most of Dina's work is school related, and in fact our agency has adopted the graduation rate as a key performance measure for our work. We also work with regard to community safety and we have a staff person full-time dedicated to addressing housing and another full-time staff person who addresses transportation issues. So we really touch across that broad spectrum of activity because health is larger than just health.
Thank you so much. Well said. And what I love about what you're going to be talking with us about too is how you connect all of these pieces. So thank you so very much. That's the sneak preview of what we'll be hearing from them a little bit later in the webinar. So let me go on here. This is challenging work, and we know that communities sometimes want or need to support to figure out their next steps. So with that in mind, let's take a quick look at the Roadmaps to Health Action Center. And the take action cycle within is really the how within rankings and roadmaps, and it lays out the process or a process communities can follow to improve health overall. It includes guidance and tools to help communities keep moving along the cycle. And along the way here in this webinar, Sarah is going to be chatting out some links to guides in the Action Center that focus on the guide that we're going to focus on in this webinar is Communicate, but also some tools from the Communicate guide. So by clicking on Communicate in the action cycle, you're led to this page with resources that help you communicate both internally with your partners as well as externally with others in your community. And when you click on this guide, you'll see key activities with several categories of tools, and relevant to today's topic is Tell Your Story. When you click on Tell Your Story as a key activity, you'll find some suggested tools. And while we won't take time in this webinar to go over all the tools, we will take a quick look at two of them. So if you click on the Tools section, you'll find a description, and I'd like to just take us in to take a little peek at what Community Commons can offer us. So we know that data and statistics can help us tell the stories about health in our community, who's the most vulnerable, what the issues are. So for example, premature death rates, obesity rates, food deserts, educational attainment, unemployment, housing, and so forth. And at Community Commons, you can actually create your own map to tell the story of what's going on in your more specific community, getting it down from just getting it at the county level. We can give you county level data. This can get you down to community level data. And you can also go to a gallery of already created maps to choose from. You'll need to register to use the site, but it is free and it's open to all. So this is one of the tools that we have in the Communicate guide in the Tell Your Story key activity. And Community Commons is a very, very powerful tool. We'd really recommend taking a look at the video that shows how to use it. And once you do, you'll see how you can create your own maps or find other maps that will be useful to you at your, even down to zip code census level. Another tool that you might be interested in has to do with storytelling, because we know that data and statistics alone don't make for compelling, persuasive messages. As Andy Goodman, the communications trainer and consultant, says, in a 2-hour speech, people will remember the 2-minute story. So in the key activity on storytelling, you'll find a tool from Spitfire Communications. It's called Introduction to Storytelling, which identifies the elements of a good story, how to collect stories, identify best uses, and how to create a story bank to easily access them when needed. And as the Spitfire tool notes, different kinds of stories will produce different kinds of reactions and results. So it's really important to be strategic about choosing a story to share. You want to consider these two questions. Who are you trying to influence or persuade? So is it a city council member? Is it a funder? And then what do you want to see happen as a result of your story? Do you want to create a new ally? Do you want to keep partners inspired and committed? Do you want to obtain more funding? So this is a really great tool. And there's another one called 2793, which Sarah will be chatting out at some point during this webinar, which once you decide who you're trying to influence, it can help you think through how do you craft that persuasive message. Finally, in the program, I also want to call attention to another rich resource for communities. It's the stories about our RWJF Culture of Health Prize winners. The Culture of Health Prize celebrates what communities have done well, as well as how they've done it. And here you'll see the 6 criteria that are central to the Culture of Health Prize. The prize recognizes communities annually who work across health factors by defining health broadly, and communities that are strategically focused on policy, systems, and environmental change, and who look out for all, including the most vulnerable in their community. These communities work collaboratively with partners from across the sectors, use resources wisely and creatively, and they measure and share success widely. And you can learn more about the prize winners on our site, which Sarah will be chatting that link. I also want to mention that our next upcoming, there'll be a Google Hangout that came through our newsletter this coming Friday at 12:15 Eastern Time, where we have a couple of prize-winning communities talking about, what it means to be a prize-winning community, what they've learned in that process. So I'd encourage you to sign up for our newsletter and sign up for that Google Hangout. So, without further ado now, we'd like to welcome our guest presenters into the conversation. And I'd like to first welcome Wade as Chief Program Officer for the Finger Lakes Health Systems Agency. Wade works with FLHSA staff and with community partners through the African American Health Coalition, the Latino Health Coalition, and the more than 14 other community coalitions that are supported by the FLHSA to create and launch projects and programs that improve community health. Wade is a native of Rochester, a graduate of the University of Rochester, and he lives in the city's 19th ward, just blocks away from his childhood home. I find that amazing. Welcome, Wade.
Thank you so much.
Thank you. And Dina Faticone is the program manager for the Healthy Kids Initiative, a coalition supported by FLHSA that's working to address childhood overweight and obesity through public policy change. Her passion for working closely with communities has led her to work in Southern Africa, South America, and the Caribbean, as well as Boston and Washington, D.C. Dina is also a native of Rochester and is thrilled to be able to bring her experience back to her hometown to help shape an environment that promotes the health of young people in the community. So welcome, Dina.
Thanks so much, Jan.
Great. Well, thank you for joining us today. And so let's just kick this off by perhaps you can give us some context. Tell us a little about Rochester, New York, and the Healthy Kids Initiative.
Well, I would start by sharing the story of Rochester, which I would say is the story of many of America's cities. Rochester 150 years ago was considered the young lion of the West, as upstate New York used to be the western frontier. We are the 3rd largest city in the state of New York, right after New York City, and Buffalo, which is to our west, a cute little suburb of ours you might have heard of. Rochester was the home of Eastman Kodak, as well as the home of Xerox and Bausch & Lomb. And so we were a very wealthy manufacturing community that, like many other cities, has been wrestling with change and changing demographics as we have experienced green flight, and many of the resources, the jobs, and the commerce that used to be in the city have left the city to our suburban ring. And our population now is just barely over 200,000 people. We are now a majority-minority city in that 42% of our residents are African American, 16% Hispanic, and 3% Asian. And as a result of that green flight, ACT Rochester, which is a very neat community collaborative that has come together, has created a very broad base of data to really help us document and understand just how profoundly we are impacted by poverty. Rochester's child poverty rate is above 50%, which is among the highest in the nation. And our overall poverty rate has 33% of our residents living below the poverty level. And as well as wrestling with these economic challenges, our school district is graduating at best half of its students. And the Schott Foundation has documented that 9% of African American males graduate from our city school district, which is the worst city school district performance in the country. So this truth is our story. And we have used this truth to build a movement that is focused on building a culture of health for our city. And I would say also that ours is a story that is made strong by understanding this tale of two cities within our city. While we have assets to celebrate in Rochester, like our fantastic city parks, our National Museum of Play, the waterfront of Lake Ontario, we also have a built environment that is not health supporting. Our transit system is car-oriented. Our food environment is really a food swamp, and crime and concerns about safety make it difficult for parents who live in inner city neighborhoods like mine to open the doors and let their children go outside to play. And so what all of this is translated into in the story that we tell is the story of an obesity crisis for both the children and the adults who live in the heart of our city. And while many of our strategies are targeted at the health of the whole population, we have a specific focus on childhood overweight and obesity, which Dina can talk more about.
And Wade, I just want to jump in before Dina starts in. Somebody was asking if you could define green flight.
Absolutely. Green flight is the term that is used by social scientists to describe the flight of wealth and investment out of inner cities to the suburban ring. We're very familiar with white flight. Green flight is more of the challenge.
Thank you. Sorry, go ahead, Dina.
Sure. Really, like so many communities around the country, childhood overweight and obesity has emerged as a major public health crisis here in Rochester, with 1 in 3 children overweight or obese. But when we look at the different racial and ethnic groups, the numbers are high for all, but are most notable in our Hispanic population, with 50% of kids, that's 1 in 2, ages 2 to 18, registering as overweight or obese. So in response to this problem, our community really came together and rallied to develop a targeted strategy under the leadership of our local health foundation. They took this on as one of their top strategies back in 2007, and we worked together as a community to develop a 4-part strategy to increase physical activity and improve nutrition in both schools and neighborhoods, to engage our clinical community in the obesity conversation, to embark on a 5210 educational campaign, and then lastly to look at policy and practice solutions that will change the environment to one where making the healthy choice is the easy choice. So the FLHSA saw this great strategy that had been developed and responded to the call for advocacy, and through that created the Healthy Kids Initiative. And at the heart of our initiative is our community coalition that built our 5-point policy agenda. And that agenda includes better school food, increased in-school physical activity, safer play areas in the community, improved food standards in childcare settings, and also policies that support breastfeeding. And really that coalition is guided by our multi-stakeholder table, which is our policy team, with some refined action teams underneath it with specific areas of expertise, Jan.
Thank you. This is very helpful for people to get that context. And I just want to say one thing also, even if you are on this webinar and this community doesn't sound exactly like your community, there are probably going to be nuggets in here that are going to be really useful to you. And I'll bet there's also things they're doing that you're already doing in your community. So as things are spurring your mind to be thinking about things in your own community, please feel free to chat chat those out, and we'll be sharing those along with this interview and back and forth with Wade and Dina. So thank you so much. You know, one of the questions, Wade and Dina, that came along in the registration, in fact, there were a lot of questions about this, is how do you balance data and statistics with individual stories? How do you leverage the power of both? Who would like to take that one?
I certainly will, and I think it is very important to leverage the power of both. I'd say that it is very clear in the world of health improvement that in the absence of data, stories help to illustrate the truth that people need to understand. And in the presence of data, stories are the connectors where the data are the dots. And what we find is the powerful impact we have of being able to present both the quantitative data and the qualitative story that illustrates the why behind the data. And the two reports that are being pictured are the reports of our African American and our Latino health coalitions. These reports really are considered to be the definitive community reports on health disparities. And what makes these reports meaningful, useful, and actionable is that they provide not only the data to say what's going on with the health of our communities of color, but also the stories to understand why health disparities exist, why individuals are being challenged with health self-management, and what it is the community can do to actually move the needle. The story that these reports tell is the map that you see, which is a map of Monroe County and its constituent zip codes, and each zip code is color-coded to reflect the socioeconomic status of the residents within those zip codes. The darker the green, the higher the socioeconomic status. The brighter the red, the lower the status. And we calculate socioeconomic status as a composite measure of the poverty rate of the zip code, the educational attainment of the residents in the zip code, their income level, their occupation, and also the household composition, so that we're able to capture persons who are living alone and those households that are headed by a single parent. And what is really striking when people look at the county in which the city of Rochester is located is how the concentration of poverty characterizes the profile of our community. And so it's not just that our poverty is high, it's that it is concentrated, and in like fashion, the wealth of our community is highly concentrated. This clear pattern of economic segregation mirrors the pattern of racial segregation in our community, and that truth is what helps our community understand and grapple with the truth that the highest rates of premature mortality, the highest rates of years of potential life lost, are in those very same zip codes where we have the greatest rate of poverty. And that story has been the focus of our African American and our Latino Health Coalition, and really has become the focus and a driver of all of the community health improvement work that we do.
Yeah, Wade, I was thinking too, as you were talking, this map exquisitely tells that story, going back to the rankings model of all of the determinants that make up health. So you've pulled it all together here in one place.
It is absolutely true that just as an effective story helps get the point across, a picture is worth 1,000 words, in terms of supporting that story.
Yeah, and it sounds like you team that in your reports, these data with real stories from real people in the neighborhoods that illustrate and bring these stories to life for people.
And what we will share is, hopefully as a takeaway of this report, is how those stories can really lead to community action and to building a culture of health despite these challenges.
Excellent. Well, and this sort of moves us into, you've talked about it at a more general level. Could you give us a specific example of what you're talking about here with, balancing data stats with personal stories?
Sure, Jan, we can do that. One thing that Wade touched on early on when he was talking about Rochester is the presence of a food swamp, what we call a food swamp. And really that food swamp exists very densely in those red areas that Wade just showed on the map. So we're working very hard to address the availability of healthy foods, or I should say the lack of availability of healthy foods, but also the over-availability of those foods that are not health supportive. And we do that in neighborhoods, but we also, a lot of our work is really focused on school food. So going back to that question of how do we balance data with individual stories, we treat kids as our consumers, and we listen to their stories. We go in and talk to them about what they like and what they don't like about school food, what we could do to make it better. And we collect those stories many times throughout the school year and catalog those. And then at the same time, we go in and we collect data about food waste in schools. So we'll look at the individual meal components. We'll record the choices that kids make for lunch and then calculate how much of that food is being eaten or thrown away. What we're really trying to do is track the behaviors over time as we do some of our interventions. I mentioned the 5210 campaign earlier, where we're really trying to get kids to understand what it means to eat healthy. So essentially, what we do is we take those stories from the kids, we take the data, everything that we're learning, and we put it together. And that allows us to come up with recommendations that are actionable and meaningful for kids and for the community. So based on what we've learned, we have built a number of campaigns around school food that include things like better nutrition standards, increasing the school district's budget to be able to purchase healthy foods, making water available to all kids at mealtime, and then looking at creative ways to make the food more appealing that don't include sugar, fat, and salt. And really, it's the consumers that tell our story. It's the kids. Whenever possible, we let them tell the story. So we have a great example, a photograph of some wonderful kids that worked on our Lunches Growth campaign. They were a third-grade classroom from School 28 here in Rochester, and they really were concerned about the state of school lunch. So we worked with them and armed them with the data that they needed to have to go testify in front of the school board, tell their stories directly to the decision makers, and really be their own agents for change.
I love that Lunch is Gross campaign. Sounds like they might have come up with that motto. That's really great. Yeah, sure did. That's great. Great example of letting the people themselves tell the story, but arming them with data so that they can tell the story in a very powerful, compelling way. We do have a couple of questions from folks for definitions. Is a food swamp the same as a food desert?
I think they are definitely similar terms. Wade, in terms of what they're trying to convey, but a food desert is really looking at the lack of access to healthy food. So how far are you away from a grocery store? I think it's, within a mile. If you're over a mile, it's considered a food desert. The term food swamp is really to illustrate that we have lots of little stores throughout our city. In one small neighborhood, you might find a store every 200 feet, even less. And really what that is contributing to is a food swamp, where there is an overabundance of unhealthy foods in that neighborhood.
Great. Oh, I had not heard that term before. That's a great term. And then another question is different communities use different sort of zip code numbers like 54218. What is 5210?
5210 is our local communications campaign, and what it stands for is encouraging 5 servings of fruits and vegetables a day, 2 hours or less of screen time, at least 1 hour of physical activity, and 0 sugary drinks.
Great. Well, because I mentioned 54218, I better define that too, right? That's 5 fruits and veggies, 4 bottles of water, 2 hours of screen time, 1 hour of physical exercise, and 8 hours of sleep. So I think there's a lot. Oh, I'm seeing some other folks have 5210 in their county too. So that's great. That's great. Oh, thank you for this. So how do you, Dina, make sure that the story you tell is about values and not just driving specific agendas or interests? That was a key question that came up in the registration questions.
It's a really good question, and it's one that we keep, in the top of our minds all the time. And really, I would say that all of our work is driven by the community and led by our policy team, which I mentioned earlier is a multi-stakeholder table. And that table includes grassroots neighborhood organizations, university researchers, pediatricians, the business community, government, local funders, other advocacy groups with similar interests and missions. It's a really committed group of people that works hard to ensure that the work we do is not only evidence-based, but it's also relevant to the community. And while we strive for consensus at our tables, we know that we're not always going to get consensus, and our team members are willing to say they'll step back if they know that what we're doing is supporting the values that we have as a community. A really great example of how this works is our partnership with our local police department. As we look at strategies to increase physical activity in neighborhoods, our community organizations sit at that table and bring the resident voice and concerns to the table, while the police department is there and they bring a deep knowledge of crime and public safety to inform the work. So what happens is that we really have honest conversations that get at the roots of the issues, and the result has been really been, a force for change in the community.
So it sounds like what you're saying is by really working kind of upstream and asking what are the root causes of the issues, it sort of gets us out of our individual frames, our individual lenses, if you will, and helps us see what are some, what's more of the common ground that we share, the root causes of all of the challenges that we're trying to address.
Exactly, and at really the heart of it all for us is how much do we value kids as a community? Because if we value kids, we'll get to the right decision.
Right, so going back to that higher purpose, the higher calling, why are we doing this work? For whom? Great, thank you. And can you talk a little bit more? You mentioned you have what does that look like? You've got this picture here of people working, keeping calm and playing on. Can you talk a little bit about this?
Yeah, really, we keep our work grounded by engaging with residents and the grassroots as often and as much as possible. And it's not always Healthy Kids and the FLHSA coming up with solutions and driving them forward in the community, but it's actually the residents themselves that are devising solutions and owning them. And really, this is ultimately all a part of our agency brand essence, which is to inform, collaborate, and transform. So we do the work to bring in experts, to educate the community on the issues that they're interested in, and to activate people's own agency for change. So that in the end, it's really the community coming up with solutions, owning those solutions, and then telling the story to make the change.
So you get out of the middle. You're not the ones that are telling the story. They're telling the story because they've been educated, and it's on those things that are important to them.
Exactly.
So kind of briefly here, do you have a communications plan or strategy? How do you balance a planned strategy with taking advantage of events that just come up as opportunities for change?
Yeah, we definitely have a communications plan. That plan includes, social media, our newsletter, our blog, and for specific campaigns, we'll also use traditional print media, radio, TV, the more common types of media. We even have a YouTube channel, but we leave space open to respond to opportunities as they arise. So sometimes we'll respond directly as Healthy Kids or the FLHSA, but as often as possible, we support our constituents and our partners to be that voice. So whether it be sending in letters to the editor or testifying in front of school board like you saw, we arm the community with those facts to go out and tell their story. Just recently, we had a number of members of our African American and Latino health coalitions and our Healthy Kids policy team that responded to a story around nutrition standards in schools in our local papers. So we worked with them to make sure that everybody had the data that they needed to back up their own story, but they each wrote their own letter from their own perspective and told a story about the community.
That's great. Thank you.
And then we also communicate through our Action Center. And the Action Center is a great tool to communicate directly with your constituents and also your local leaders and decision makers. So anyone can click on our Action Center and they can see what we're currently working on. Community members can take any of the information they see there and communicate directly with decision makers. And then they can also see what's happening at the state and federal levels around policy changes that may affect us locally. And while we don't lobby directly, we do track relevant pieces of legislation so that we understand what impact it might have on us as a community. And then we also, while we do traditional advocacy here, we do some really fun stuff. We create tweets that people can tweet directly at their local officials. So it's not always about writing a long, lengthy letter, but getting your message out in a clear and concise way.
Oh, that's cool. I haven't heard of that before. That's great. I'm sure that's happening in other parts of the country, but that's the first time I've heard of it. And could you talk a little bit about who you're telling the story to and through whom? Wade, maybe you could take that one.
Yeah, I'll recap in that absolutely our aim is to make sure that we take advantage of the fact that the best experts are the people who are actually living the situation, whether it's the students who are actually in the classroom or the parents. They know the facts. They don't have the data. If we provide them with the data by which they can document and validate their lived experience, we're able to impact change. So our storytelling is really aimed at talking to thought leaders within the community in the belief that if they are able to tell the story as their story, they will be able to impact the thoughts and beliefs of those with whom they come into contact, and that's how culture change occurs. So we rely very heavily, as pictured here, on barbers and beauticians. Saturday mornings in the barbershop, Friday nights, you've got lots of people who live in the heart of the city who are in barbershops for 2-3 hours at a time. The barbers and the stylists are excellent conduits for us to get our message out, so we tell our story to them. To the ministers, the clergy, and the lay leaders of our various faith communities of all denominations, of all cultures, because of the fact that for those people who have relationship with the faith community, that's effective. We spend lots of time talking in work sites. We have a squad of health ambassadors, hundreds, who are out in the street, in the corners, in the neighborhood festivals, helping to tell the story.
Wow. That's great. That's perfect. So we're sort of coming down to the end of this more formal part of the back and forth. And could you share with us some of the important lessons you've learned along the way?
Sure. Very quickly, I'll just say the lessons that are here on the slide, that we learn a lot by not being quote-unquote successful. So to recognize mistakes, that we learn through failure, that we stay nimble, that we listen to and learn from the community, and then realize that with resources, people will recognize their power to create change. Deborah Ness says it very well. It's not build it and they will come, but rather it's if you build it with them, the people will already be there. And so we take great pains to make sure that we never are going in a direction that our community experts, the leaders themselves, tell us makes no sense.
And I love how this quote sort of wraps all of that up. If you want to go fast, go alone. If you want to go far, go together. It's beautiful.
Amen.
Thank you. Well, we have come to the bend in the road. We're going to reflect again on the questions we asked you at the beginning of our webinar. What else do you need to know to take action and use this information? This will give you a chance to kind of collect your thoughts. And let's see if we can answer some of your questions too that perhaps we didn't get to during the back and forth of our conversation. So I'm going to turn this over to Sarah and see if there are some questions that have bubbled up during this dialogue.
Great, thanks, Jan, and thank you, Wade and Dina. So I have a couple questions that have come up. These came from the pre-registration questions, but I think they're particularly relevant. So the first one is about your target audience, and how do you determine your target audience?
We first of all start with the data so that we understand not only the nature of the problem, but it gives us the ability to identify who the affected population is and who and what are the resources that can help address the problem. And then by convening stakeholders, the stakeholders engage with us in the process of identifying the primary audience as being the people who must take action, whether it's advocacy or rather the target of advocacy. That becomes how we define the audience for the communication. And then we look at the secondary audience as being who are those thought leaders, opinion leaders who can help shape the attitude of the advocacy target. And so for each activity in which we engage, there might be a different target audience, but at our strategic agency level, the target audience is who are those people who can really deal with the sad reality of our community, that the profound socioeconomic inequity is the true driver of the health disparity.
Thank you, Wade. So another question that I think could be useful to our audience, there was a general theme that came through the registration questions around the use of a new tool to tell stories, which is the use of social media. So how would you, Wade and Dina, how would you say, based on your experience, that you have effectively used social media? And a follow-up question to that is, how do you share a great testimonial using social media?
I think you're absolutely right. Social media is a very powerful tool, and it can be powerful in many ways. You can use it in a way that may not support the work you're doing, but you can really use it to support what you do if you're tuned into the environment and understanding where people are. So really, I think the key is meeting people where they are, sharing reputable information, and cutting through the jargon. In the health health sector, there's a whole lot of jargon, and we're very aware that our followers may not be tuned into that jargon. So we make sure that what we put out there in social media is relatable, that we're not overwhelming people with information, but rather maybe sharing some visuals or some simple statistics that can help people to understand the issue.
I would amplify the point that visuals work much better than words. We are very conscious of making sure that in the course of the day we find opportunities to document our work and make sure that the pictures include community folks and not just ourselves. Those are generally the moments where we find ourselves with lots of traffic in social media, when the pictures are people having fun, people who are identifiable, and people who will take our connect and then rebroadcast it through their social media.
I think, Sarah, to answer your follow-up question around how do we get those stories, those testimonials out there, I think one way we do that is through our blog. So we will engage community members to write guest blog posts for us, and we often will support them to do that, to make sure that they're getting across what they want to get across. But that's one powerful way that we've found that they can share their story online and through social media, and then that gets sent out through our Facebook, our Twitter feeds, and is right there on our website as well.
That's great, Dina. Thank you. So another question has come up that I think the two of you might have some wise words about, considering the amount of collaboration that clearly has gone into your work. So the question is, how do you tell stories when multiple organizations are involved in the work?
I do not believe that we have found there to be a challenge insofar as we make sure that the story that we're telling is one that people have the ability to place their own stamp or organizational identity on. And we try and make sure that we're doing that by being clear and honest. If we want a partner to tell our story, we have to make sure that we're giving space for the partner to truly be involved, to truly help inform and shape what we do. And so collaboration is a messy process because it requires that community table, and that's what we consider ourselves to be, to truly be an honest broker. We are able to do so because we don't deliver any program. Our partners deliver program. We simply provide the foundation and forum for the collaboration to occur, the data and the analytic to support the collaboration, and where necessary, we act as a catalyst to kick things into action. Because we're not a competitor, it's very easy for us to make sure that there's room for everybody to be a hero. There's enough work to be done that everybody can take credit for it, but nothing will happen if everybody doesn't work towards the goal.
That's great, Wade. Thank you for that. And I think people will benefit from hearing it because I know that that's not the norm. So it's great to hear that that's the practice that you all employ.
And it is very challenging for us to make sure that we are remaining honest and not being a competitor. And there are many things that we look at colleagues and say, boy, it'd be great if we could do, but we do not do anything that one of our partners could do. If we have that great idea, we carry it to a partner and we say, you know what, we think this can and should be done, and we'll provide technical assistance and support to help you do it.
That's great. Thank you. Well, one other question for you both, which is, again, about the process of telling stories compellingly. So this question asks, how do you tell which stories that are most compelling? Or maybe a better way to phrase that is, how do you choose which stories to tell when word limits don't allow you to tell them all?
Well, what the best story to tell is the story that is relevant to the audience and the story that is communicating the call to action. And so we always have more things to say than the time and space to say it, and we use the window of opportunity as being the major filter. And there are some stories we've wanted to tell that we have just kept on the shelf until the time was ripe. There are ripe moments where we say, OMG, we've got to jump on top of this, and we radically reorganize ourselves to take advantage of that window of opportunity. The most important thing to do is to make sure that we are salient, that we are relevant to the communities that we're trying to support.
I think I would also just add that we want our stories to be concise. So we're very careful that we focus on one thing at a time, that we're not trying to get all of the stories and all of the data and information out there at once, but we're very strategic in terms of how often we're trying to tell a story so that, you know, we're not flooding the community, we're not flooding the media so much that they stop listening, but we're keeping things out in, you know, creating public discourse in a timely way.
Thank you both so much. So at this point, I think we'll have to put a cap on the questions, although I do want to plug that we're going to have this opportunity at the end of the webinar to continue our conversation. I'm going to turn it over to Jan, but before I do, I just want to add that we received a comment that I'd love to share with you, Wade and Dina, publicly, which is that the defining of your core values and the way that you state them is inspiring. And I think that I can say that's true for everybody listening. So thank you both.
Thank you.
So as we wrap up, we want to let you know that thanks to the support of the Robert Wood Johnson Foundation, we have 11 community coaches, 4 based in Madison, Wisconsin, and the others regionally around the country. And our assistance is available at no cost to you as a community. And these coaches, you can reach us through the orange boxes located throughout the Action Center. And at any time, you can get personalized free help. It's really the best way to connect with one of our community coaches. So please don't hesitate to contact us if you need assistance with a tool, a question, or figuring out the next step in your process. And Sarah has chatted out that link right now. And we also want to encourage you to use social media. We've been talking a lot about social media to stay in touch with and communicate about the County Health Rankings and Roadmaps program, to stay in touch with us through Twitter, Facebook, and e-newsletter. And just a flag on this, being a newsletter subscriber will also alert you to our upcoming webinars and our Friday Google chats, our Hangout chats. So please do make sure that you're on our newsletter for that. And this program is the result of the contributions of many partners, including those listed here. And we're very, very grateful for the wonderful collaboration that puts together this program, including our community partners like Wade and Dina. And at the beginning of the webinar, we introduced this guiding question. We hope this discussion has generated some new ideas for you and some new thoughts about how you can use your own stories and lessons learned to continue to build a movement for a culture of health in your community. We know you're already doing a lot of good things, and please do let us know about those. We would love to connect you with others, and we'd love to get connected with you. So a generous thank you again to Wade and Dina for sharing their strategies for using stories and lessons learned. And we look forward to seeing each of you who are on the webinar now on our next webinar. And again, if you'd like to stay on for 10 to 15 minutes for an after webinar chat with Wade and Dina, we'll be unmuting lines in a couple of minutes here. If you're able to mute your own line in order to cut down on background noise, we'd really appreciate it. And once we've unmuted, we'll ask that you raise your hand to speak so that we can call on people one at a time. So again, this is an experiment. We'll see how it works. If it doesn't work, we'll stop the experiment. But thanks to Wade and Dina for being willing to lean into this with us. And we'll see if anybody's interested in this. It's another way to connect folks with each other and with our presenters directly. So thank you all. And we'll give a couple of minutes here for people to get off the webinar. And those of you that stick around, I will then unmute you in 2 minutes. Thank you.